Today I'm going to talk about a practical way to develop cardio HIIT and take it far from sports centers and professional athletes and take it to the homes of people in remote areas and all people to need it. First of all, I want to talk about a personal experience as one of the ordinary people. During my childhood, I was born and raised in a city that is well known for its 120 windy days and full of dust. So, owing to the long-term exposure to this weather condition, gradually my respiratory capacity decreased. So it caused my life to be in low quality and harmed my daily performance. I try to change my lifestyle by doing sport, and I have found out that there are too much information, guidelines, and complex. There were many articles about sports and workout routines. They were hard to follow. And it means I had a question like all people, what can I do as a patient through simple and safe methods to get better, or as an ordinary individual to keep diseases away and having a healthy lifestyle? Okay, let me show some highlights from the ESC, European Society of Cardiology guidelines. Individual with cardiovascular disease, if able, should engage in at least 120 minutes of moderate exercise per week over 5 days. Three sessions of resistance training per week have additional benefit for individuals who are obese, hypertensive, or diabetic. Symptomatic individual with mild hypertrophic cardiomyopathy and a low ESC risk score and absence of markers of high risk may participate in all competitive sports. Individual with active myopercarditis, arrhythmogenic cardiomyopathy, and poor left ventricular function shouldn't engage in intensive exercise. Regular exercise is fundamental for preventing atrial fibrillation. However, too much exercise may increase the risk of atrial fibrillation. And individual with an internal cardiac defibrillator and those on anticoagulation should avoid contact sport. But how to use this guideline? They are so hard to follow because most doctors say to people do this or do that, and without observation. But who is responsible? Doctor, gym, coach, sports medicine specialist? I don't know. In the gym, what they are expecting is completely different from what the doctors prescribe and what is recommended by a professional athlete who usually acts as a coach. The patient, the point is that the recommended exercise given by those professional athletes is usually for professional athletes, young and healthy population, and in fact, isn't for the typical individual like elderly and middle-aged people or patients. I know you may disagree and be of the opinion that there are centers or sports complexes with all facility, educated and certified doctors and coach even sport medicine professionals. Yet we all know the major point is something different. Unfortunately, most guidelines and recommended procedures are applicable and doable in the limited centers. Nevertheless, people in remote areas who are only benefited by local doctors are deprived from even a small gym. So to improve patient care, clinicians, patients, and athletes, recreational athletes should be able to recognize specialized care pathway, expertise centers, and clinicians with sports cardiology expertise easily. Consequently, several international societies and organizations recommend establishing a local and national sport cardiology infrastructure. So what do we need? We need to unite all single organization which could focus on cardio sports as the main solution to the mentioned problems. What is the answer and who is responsible again? IFCH. IFCH is the International Federation of Cardio HIIT, founded in 2020. IFCH is an official member of TAFISA, the Association for International Sport of All, and it has one primary goal, which is promoting cardio sports worldwide for both men and women without any political, cultural, racial, and religious affiliation. Its slogan is the healthy heart for everyone. And why IFCH? IFCH Federation intent aim is developing and extending cardio exercise all around the world for everyone and help countries to improve their public health, their society, and reduce heart disease. Why IFCH again? As a doctor, I came across with one single challenge as the main dilemma for me and my patient. It was maximizing safety in sports. We will know it should be done by following procedure cardiovascular screening, differentiation cardiac modeling from pathology, clinical evaluation, management of symptomatic athletes or athlete with cardiovascular disease, ranging from amateur, elite to elite level. It means that one single organization answers almost questions about procedure, workout routine, and protocol defining close contact with doctors and patients and sport professionals to conduct safe and effective ways to promote health among all people. IFCH focus on having sport cardiology core curriculums and establishing multidisciplinary networks. But how about making one single sport safe and sound for everyone? So the International Cardio HIIT Federation has been established with a specific definition and is developing and training cardio movement plans. Some of the advantages of cardio workouts suggested by IFCH: without using equipment, all sections of society from young to old can do the movements on different levels, from beginner to professional can perform in this field, exercising without additional or high cost, available to everyone, easy training for everyone, paying attention to the importance of the cardiovascular system in society, and also for the employees of public and private organizations, reducing medical and living expenses, creating freshness and liveliness in the society, having a healthy heart is a social right for all members of society that can be done by developing cardio workouts and creating an easy, affordable, and low-cost cardio culture. The aim of cardio is the development of public sport, and the goal of HIIT is the development of professional sports. The purpose of holding competition is an excuse to attract people and motivate them to exercise in any way they can. In cardio HIIT, you never reach the last level of movement because this sport is always being updated. IFCH established easy bilateral relationship between sport coaches and doctors by setting a standard and training program. Exercise protocol, aerobic and resistance exercise, equipment, frequency, duration, intensity, use of high intensity intervals, modification for physical impairments. Use of adherence strategies with participate. Adherence strategy, for example, set goals, rate confidence, graph exercise, heart rate watch, feedback principle. Coach-participant relationship, sample initial and weekly visit protocol script, database use and documentation, principle of coaching, motivation, persuasion, communication technique, problem-solving adherence. In order to advance the stated goals, here are some suggestions. Bilateral cooperation of doctors and the sports coach in such a way that patients who don't have indication drug treatment are referred by the doctor to the cardio HIIT coach. So according to his condition, suitable exercise are given to improve the performance and health of heart and prevent possible common diseases. And also referring people from trainer to the doctor to give us necessary medical advice to people who are doing cardio exercise regularly and according to the program to do checkup and reduce the risk of injury in sport training. Designing a health notebook for each person to assess physical condition and record individual progress. All we know, taking care of health should be the most priority for everyone, since cardiovascular diseases is one of the leading causes of premature mortality and global death in the world. Those diseases are highly related to the sedentary lifestyle and stress rooted in today's modern life. Cardio HIIT workouts as high intensity intervals training using body weight not only could improve heart health, but also has an advantage over traditional sports. And by the way, in my perspective, one of the most important group that need a regular exercise program and do as much exercise as possible are we as doctors who often due to the high and heavy workload may neglect these important things and forget ourselves while we can be effective as a role model and even a coach in some fields like cardio. So I think IFCH could be the solution to many problems. Thank you for attention.
Any questions? Thank you so much, doctor. You have shared the importance